Good afternoon, everyone. Today, Julian, Caitlin, Mim, and myself, Voltaire, will be discussing about plantar fasciitis and obesity.
Our patient is called Peter Porker. He has a sore, sharp pain in his left and right heel. The pain arises as soon as he wakes up in the morning, and walking around the house barefoot can be a burden. He is a 45-year-old male and has a BMI above 30. Peter works as a photographer during the day, meaning he is always on his feet. He also works at night helping the community. He usually wears a pair of Nike Free Runs, which are about 2 years old. The shoes are very worn out and have lost their support and cushioning. He also has extremely flat feet and tends to overpronate when walking.
Now we move on to the medical and pediatric history of Peter. Now, for the medical history, the patient has a family history of obesity. Both his parents were obese, as well as his Aunt May, who he has lived with for most of his life. The patient is obese. To combat this, he has been taking orlistat, or trade name Xenical, to assist in reducing his weight and possibly BMI. For the pain in both his heels, he has been prescribed paracetamol, trade name is Panadol, whenever he plans on working during the day. Now for the pediatric history, he visits his podiatrist for regular checkups due to the numerous times he has had sore heels, especially after he wakes up in the morning. And the patient has had prior visitations to his podiatrist for reoccurring plantar fasciitis.
From the described symptoms, it is apparent that our patient has plantar fasciitis. This is evident from the pain experienced by a patient within the first few steps of awakening, as well as from the pain experienced while standing after a long period of inactivity. Further contributions to this diagnosis include the patient's weight. As the patient is significantly obese, he will be exerting more weight onto his feet, therefore increasing the risk. This excess weight also leads to the patient being flat-footed, pes planus, which is a further risk factor for plantar fasciitis. Likewise, the patient is wearing thin-soled shoes which lack arch support and an inadequate cushioning system. This is another likely contribution to plantar fasciitis. Plantar fasciitis is inflammation of the plantar fascia, a ligament which runs across the plantar surface of the foot, connecting the calcaneus with the toes. The plantar fascia has a thicker central component and weaker medial and lateral aspects. The role of the plantar fascia is to hold the components of the foot together, help protect the sole from injury, which is important as of the 20 muscles in the foot, 14 are located on the plantar aspect, and to help support the medial and lateral longitudinal arches of the foot. The pain is most commonly noticed along the medial side of the plantar fascia, as this is the area where most of the load from the body falls upon. This is particularly of concern for obese individuals, as their excess body mass will put further pressure on the medial side of the plantar fascia, therefore increasing the risk of plantar fasciitis.
Peter Porker has many biological factors and lifestyle choices that unfortunately place him in the high-risk category for plantar fasciitis. His lifestyle choices include his higher than average BMI and his long periods of time that are spent on his feet due to the nature of his job as a photographer. These two factors combine to cause increased periods of heavy weight bearing on his lower limb. Peter also chooses to wear unsupportive footwear, as you can see on this slide. It can be suggested that this footwear is also a causative factor for his plantar fasciitis. The biological factors that impact Peter are his flat feet and his limited ankle dorsiflexion on both his affected and unaffected limbs.
Feet are made to carry a normal weight. Excessive weight puts great pressure on the bones, nerves, muscles, and ligaments in the feet, which will have a further consequence, and this can lead to plantar fasciitis. Flat feet or overpronation can lead to plantar fasciitis. The feet are rolling over medially, and this causes the muscles to elongate. This puts excessive strain on the ligaments and muscles, specifically the plantar fascia. The plantar fascia runs from the heel bone to the toes of the foot. The strain of the plantar fascia during the overpronation causes inflammation and pain. The foot needs to be realigned to help treat the pain. Having unsupportive footwear like old Nike free runs can lead to plantar fasciitis, as it offers no support and affects the walking pattern. The Nike shoes offer no medial arch support, leaving the patient with flat feet and overpronation. Furthermore, the shoes are extremely old, meaning the cushioning has worn out. Being overweight can also compress the shoes and lack support, meaning more pressure on the feet.
There are large amounts of evidence available linking obesity and plantar fasciitis together. A systematic review conducted by Wachowski et al. Examined 4 studies, 3 of which were focused on clinic populations and 1 that was comprised of volunteer participants. Overall, a moderate relationship between plantar fasciitis and weight-bearing tasks was identified. Individuals who have a higher BMI would be included to be at risk, as they would have increased weight-bearing due to their larger mass. The authors of the systematic review identified threats to their validity, as high levels of bias were identified in many of the articles, and those studies selected were considered to be of a low quality. A second systematic review was conducted by Irving et al. It looked at 10 studies with participants ranging from 30 to 55 years old. The review found a strong association between a high BMI and plantar fasciitis in a non-athletic population. The review acknowledged that there are other factors that can contribute to plantar fasciitis. However, in these studies, it can be believed that an increased BMI and calcaneal spurs are the 2 most significant factors. A third systematic review was conducted by Butterworth et al. It examined 25 studies with participants who ranged from 18 to 80 years old. A strong relationship between a higher than average BMI and musculoskeletal foot disorders, including plantar fasciitis, was evident. The review noted that the prevalence of obesity has been recently increasing, thus the incidence of musculoskeletal foot disorders is also likely to rise. To combat this, it was suggested that weight loss should be investigated as a further method of treatment.
Now it's the management of plantar fasciitis and obesity. For plantar fasciitis management, having correct and appropriate footwear will help manage the plantar fasciitis, as it will realign the muscles and ligaments in the foot. This will stop the overpronation and prevent flat feet. The podiatrist can refer Peter to active feet or the athlete's foot to get fitted into the correct shoe. There have been some clinical studies which have suggested that plasma-rich platelet, also known as PRP, is a safe and effective treatment for plantar fasciitis. His practitioners could also provide advice to Peter to work less while standing still with minimal activity. He can also be given anti-inflammatory drugs or medicines such as corticosteroids. And finally, general stretching of the fascia has evidence to support this effective, cheap, and straightforward way to manage plantar fasciitis. Now for the obesity management. Personal interventions include weight loss management programs and general practitioner intervention. These programs and intervention would modify his lifestyle and behavioral activities. Additionally, the current obese weight status of Peter is considered a risk factor for plantar fasciitis. Therefore, reducing his weight can also help alleviate his heel pain. For medical interventions such as pharmaceuticals, Peter can be provided with paracetamol and a drug called orlistat, which has the trade names Exenicol and Duramine. For lifestyle modifications such as physical activity and healthy diet, it is recommended for him to follow realistic expectations that can be implemented into his daily routine. Furthermore, it has been conveyed that an obese person who completes physical activity and is provided with a healthier weight more quickly will develop strong physical active belief and produce longer influence. For behavioral modifications, it would require the setting of principles and techniques for Peter. Peter and his health practitioners would need to create a goal set for his exercises for a daily routine that he can follow. It would also be beneficial if he keeps a record of the amount of calories he intakes on a daily basis. Finally, here are the references we used. Thank you for listening.